Hello and welcome to another episode of the Health Notebook. Today we have Nerosha Mohammed in the studio and we'll be exploring the concept of the speech therapist and the role that the speech therapist can play in an individual's management. Hello and welcome.
Assalamu alaikum and good day.
Okay. Can you maybe just tell us a little bit about yourself?
So I studied speech language pathology at the University of Cape Town and graduated in 2009. Thereafter, I completed my community service in the rural areas of the West Coast District region, where I then worked there for a couple of years. When I got married, I relocated to the Department of Education, where I formed part of a multidisciplinary team, which is called the SPID team. So that's children with severe to profound intellectual disabilities.
Okay, and what does that mean? Or just to explain to the viewers, yeah.
So that basically, we form part of a multidisciplinary team of OTs, physios, speech therapists and psychologists, where we used to travel to various special daycare centers and provide therapy to children with autism, cerebral palsy, fetal alcohol syndrome and any other syndromes that there are.
Okay, so what does a speech therapist actually do, firstly?
So as speech therapists, we treat and assess children and adults with speech, language, communication and swallowing difficulties. So we help patients to become independent communicators by using speech, gestures or communication aids as needed. We also treat and assess children and adults with eating, drinking and swallowing difficulties as well.
Okay. What's the difference between a speech therapist and an audiologist? And there is some confusion. So just to make the general public aware exactly what's the difference?
An audiologist is a healthcare professional who evaluates children and adults with hearing loss, tinnitus and balance disorders. They also provide hearing aids to patients. Whereas with the speech therapist, we assess and treat children and adults with communication, speech and language disorders.
Okay, and where would one find a speech therapist? I mean, where are they located? Just to give the viewers some indication.
So a speech therapist can work in both government and in the private sector. So you would find them in hospitals where they would then see inpatients and outpatients. So you'll find them in the hospital setting where they will provide therapy to in and outpatients, community health clinics, special schools, normal schools, as well as patient homes as well.
Okay, so when you say special schools, what's your involvement in that special school? What do you enable that particular child with a learning disability? Just to give the viewers some insight as to what you actually involved in that particular care.
If they are children with special needs population, so what we would do is we would provide them with alternative and augmentative communication devices. So those are, for example, picture exchange systems where children use pictures to communicate their needs, or if they're unable to use pictures, then we would use eye gaze or hand movements or head nods, so that it's easier for the communication partners to understand what the child wants. We also work on like language, for example. So trying to provide trying to work with the children's receptive and expressive language. So making them understand, for example, what a cup is, what a pen is.
Okay, so you've mentioned some patients now. You've mentioned children. You've mentioned in hospital environment. So what are the range of patients that you see? Yes, you can have an illness, and then the individual will come to you, for example, after a stroke. What are the different categories of illnesses that you'd see? But not only illnesses, other aspects of speech as well.
Okay, so we see a wide variety of different types of patients. So we see babies with feeding and swallowing difficulties. So those are your kiddies who are premature and they perhaps on nasogastric tubes, or they can't feed properly, sucking or swallowing. Children with learning difficulties, developmental delays. So those are your children from 0 to 3 years old who, for example, are unable to speak yet. Then we see language disorders, difficulties in sound production. So those are your articulation. So that's when a child, for example, can't pronounce the S sound or the R sound. Babies who are born with cleft lip and palate, voice disorders, as well as stuttering.
Okay, and in terms of adults, what range of patients would you see besides those individuals that, for example, as I've mentioned, a stroke? What other range of adult patients would you see?
So we would see head injury patients, eating and swallowing difficulties caused by a stroke or a head injury, degenerative diseases, for example, motor neuron disease or Parkinson's, to name a few, cancer of the head, neck and throat, as well as voice disorders.
Okay, so in terms of therapy, what does this actually entail? And a speech therapist and therapy, just to inform the viewers, what does the therapy entail?
So therapy is very widespread, and it depends really on the nature of what the patient presents with. So for example, if we have a child with developmental delay who is 2 years old, therapy would then involve play, and it would involve teaching the parents on how to stimulate the child's language at home. Versus an adult who has had a stroke and perhaps has eating and swallowing difficulties, our main aim there would be to prevent the patient from aspirating. So here we would then provide the patient and the family with techniques to allow for safe eating.
Okay, so just to inform the viewers, the whole concept of aspiration is some of the food actually goes into the lungs, and then you can develop an infection, and this can be as a result of a medical illness, and where you actually lose your basic functioning, and then as a result one would develop the aspiration. Then so you actually come in and you assist them, and you give the family as well some insight in how to manage that situation. Okay, and what role does the patient actually play in this entire treatment? So
therapy is very client-centered, and the patient obviously plays a very important role in the outcomes of their therapy. So patients need to be motivated and dedicated towards therapy in order for progress to be noted.
I know we're discussing a fairly broad range of medical illnesses, and we'll be touching a little bit more in detail when we cover those individual illnesses on a later stage. So this is just giving the viewers a sort of global overview of a speech therapist. Just to inform the viewers, what is the role of the family or the caregivers in this rehabilitation and part of the treatment?
So family and caregivers also play a crucial role in the patient's progress. They provide a supportive environment during the therapy process. So whatever the speech therapist has taught the patients in sessions, that is what the family would then transfer. The family would then transfer those skills into the home environment.
Okay, so that would be similar to physio and the occupational therapist, where they equip you with the skills, and then it needs to be taken to the home, and with the supportive environment there needs to be this continuous engagement in whatever you've equipped them with. Okay. So
during in therapy, we don't only teach the patients what to do, we teach the family and the caregivers as well, because we find that obviously works much better. And like we said, it provides a supportive environment for both.
Now let's just take something common that you would probably see within in your private practice. Can you just give me an example of what you would provide the patient with and what you would equip the family with, as in what they should do at home? A simple example, just to inform the viewers.
So for example, a child who is 5 years old and they have an articulation and phonology disorder, so that is where maybe the child can't say the sound. So what will happen is during therapy we will do an assessment and then provide the patients with homework, and then with this homework the parents need to ensure that the child practices these sounds every day.
Okay, so that is now where the family's role comes in, and with practice eventually they'll reach a certain outcome. Okay, so obviously my understanding, and just to inform the viewers as well, it's not just one session before you notice improvement. There is a number of sessions before you can actually see a difference. Okay, if I may ask now, do you, just to inform the viewers as well, you work with other health professionals as well? Just name some of the other health professionals that you'll work with, and you form part of a multidisciplinary team. So just to inform the viewers, just to give them some insight, where would you fit in with the other health professionals?
Okay. So there are many times where I do work alone, but it's very patient specific. So for example, like articulation patient, that would be purely a speech therapy concern or case. But if there are patients with if there are patients where we identify a need, then we would, for example, work within a multidisciplinary team. So that's I work very closely with the occupational therapists, physiotherapists, as well as pediatricians, because they are the with the occupational therapist and the speech therapist would then work together to attain one goal for that patient.
Okay. Now in terms of frequency of sessions, I know we previously mentioned it's not just one session. Just inform the viewers in terms of frequency and average amount of sessions. For example, for a particular illness that you'll need to correct it. Just some insight in terms of the treatment and the number of sessions. I know each individual is unique, so just your insight in terms of long-term treatment.
So the duration of treatment usually depends on the patient's diagnosis. So treatment can take up to a year, more or less, and it also is determined on how quickly the patient progresses through therapy. So in government, because of the number of patients that we see, we usually follow up with patients once a month or once every second month. But then we provide a home program to parents or caregivers. So in private, it is much easier to see patients once a week, which is more ideal because then progress can be seen much faster. However, this is also dependent on the financial status of the patient.
Okay. Now, in terms of some of the challenges, can you maybe just highlight some of the challenges that you would have in practice?
So the first one is the lack of resources. The DNA, so the did not attend rates are usually high due to the amount of therapy that is required. So we find that parents can't take off from work as often as we would like them to. Medical aids are usually depleted. Patients' motivation towards therapy becomes limited when progress is usually slow.
Okay. Now coming back to the speech therapist and what you've done, I think this is just important. How does one actually get into speech therapy, and where does one study speech therapy? Just to inform the viewers as well.
There are two universities in Cape Town where you can study speech therapy. So that's at the University of Cape Town and the University of Stellenbosch. You need maths and you need biology as well. And
in terms of the occupation itself, is it very rewarding, and what's your personal take on that?
The occupation, it is very rewarding, but you need a lot of patience. Like I said, therapy can take very long, and patients can become very demotivated. Therefore, the therapist needs to be positive in the therapy environment in order for patients to progress.
Okay. Can you maybe inform the viewers when would it be advisable to actually see a speech therapist?
As soon as the problem or the concern has been identified. So early identification is key. So the sooner we start therapy, the more beneficial it will be for the patient and the family.
Now, in terms of some examples, can you maybe just give me one or two examples just to highlight to the viewers what role you actually play in the management of a patient? So if you can give me one example.
An example of a stroke patient.
Okay.
So usually with a stroke patient, depending on what side of the brain is affected, so we would work with speech, language and communication difficulties of the patient. So say for example, the patient has slurred speech caused by the stroke. We would then give the patient various techniques or exercises to do, for example, facial massages, oromotor exercises that would increase the.
So, when you mean oromotor exercises, what does that mean?
So oromotor exercises would be facial massages, tongue exercises, exaggerated lip movements. Puffing up of cheeks, for example.
So those exercises are meant to strengthen the muscles, the facial muscles. Yes. Okay. And progressing forward, besides the orofacial muscle exercises, what else would you provide?
We provide communication aids, so that is your alternative and augmentative communication devices for stroke patients who have severe speech difficulties.
One or two examples of alternative or augmented devices, just to inform the viewers.
So you get high-tech and low-tech. Usually in government we would use low-tech devices, so those are paper-based devices where there are pictures on. So you have pictures of basic communication needs. For example, I'm hungry, I want to eat, my stomach is sore.
Okay, so these are all on pictures. And in terms of the high-tech devices?
The high-tech devices are actual devices where you could, for example, have pictures and you'd press a button and the device would speak back to you. So you could press on warm and the patient will say, the device would say, I am warm.
Just alternative means of communication due to the individual not being able to speak. Okay. So I know you've mentioned the oromuscle facial exercises, you've mentioned augmented devices. What other aspects would you get involved in assisting this particular stroke patient?
So eating and swallowing difficulties is very common, which is very common after a patient has had a stroke. Aphasia, so there we would then provide the patient with various activities and exercises to do, and that would be maybe object identification, confrontational naming of objects or pictures. And then a big one is also apraxia of speech. That is a motor programming difficulty which is caused by a stroke.
Nerosha Mohammed, it's been a great pleasure having you on the show, and we hope to see you again.
Okay. Thank you for having me on the show.
Is there any other take-home message that you'd like to give the viewers?
So early identification is key. As soon as you or family member have noted a concern, make an appointment with your speech therapist. Do not wait until it is too late.
Thank you very much once again. Stay tuned for another episode of the Health Notebook. Same time, same place next week.